So, good evening, friends, and welcome to another amazing episode of Crossing Boundaries. We are at session 10, and today we are going to talk about space maintainers. It's a very, very important topic, and I'm confident that people who have children at home would appreciate what we are talking today, and all those people who are elderly, they will be understanding why probably their teeth has not come in a proper alignment, right? Thank you so much. So, good evening, friends. And as I told you, like you see in this picture, once you remove your deciduous teeth are the teeth which are milk teeth, as you would know it. We also call it the primary teeth. So, once you remove the primary teeth, and if you have not replaced it properly, or if it has been removed earlier in time, then your teeth will move front and back, and that is how you will lose your space. Once you lose your space, your teeth will be malaligned, or some teeth might not even erupt into the oral cavity. So this session is actually taking place with a request from a number of parents of children in our practice, and that is how I thought, this would be helpful for many of you. So looking at this picture, if you can understand that right from 6 years to 15 years, what happens is you have your primary teeth, that is the teeth which erupt in your oral cavity from the age of say 6 months of a child's life till 2.5 years, all the primary teeth already erupt into the oral cavity. Now, from 2.5 years to 6 years of the child's age, you will have all these primary teeth. Now, from 6 years to 13 or 14 years is when the permanent teeth come into place. Now, as the permanent teeth come into place, what they do is they try to resorb or remove the root portion of the primary teeth. So when you look at the diagram, you can see when you see A, you will see the root formation happening in B. And as you see the diagram E, you will see the same tooth looks very small, the primary teeth, the light pink color. However, you also see a dark pink colored teeth overlapping on the top of that teeth. So as we all understand that when we are children, our jaw, our face, everything is very small. And as we grow elder, you will see that the jaw also grows, and that is how it is able to accommodate the bigger size teeth. Many a times you would have also seen children probably at the age of 12 or 13 where you will see them having very big teeth, but the face will be still small. So God is very kind. God knows how tall or how big or broad our face will become, and that is how God designs the teeth and sends it for us. So that is, the beauty of life. So how do I take care of my teeth in the mixed dentition? I told you from 6 years to 13 or 14 years, we call that period as a mixed dentition. Primary teeth, I told you, 2.5 to 6 years of age, and after 14 years, when there is only permanent teeth, we call it as permanent dentition. So that gap where the milk teeth are falling off and the permanent teeth are coming is called the mixed dentition. So in our oral cavity, if you see, when we have the milk teeth, we have 20 teeth in total. That is 10 teeth on the top, 10 teeth on the bottom. And if you look at it, if we divide the mouth into 4 quadrants, we'll have 5 teeth on one side. Whereas when you think about the permanent dentition, you have 8 teeth. So 8 fours are 32 teeth in the total numbering of the number of teeth in the oral cavity. So what basically happens is, if there is any injury, or if the child falls down, or if there is a trauma, this teeth might fall off early, thereby there might be a closure of the space. So when that, when the fracture happens or when the trauma happens, so that is when we give a space maintainer. A space maintainer is defined as an appliance. Now, why do we say an appliance? It means it's an external fixture into your oral cavity. It can be made with metal or acrylic material. Acrylic is the plastic kind of material which you keep in the oral cavity, and this is custom made. So we take impressions of the child's mouth and then we make or you design the space maintainer. And what does the space maintainer do? It maintains the space so that the permanent teeth have place for them to come. So they might not be there right now, but if the space is closed, then there will be malocclusion. Malocclusion means the teeth will not be aligned properly. Because it is not aligned properly, you will have a lot of other problems. So you must be thinking, oh, so I must have also lost a lot of teeth when I was growing up, but I didn't wear any things like this. So not every child would need a space maintainer, and not for every baby tooth which is falling down also. So when a tooth is falling down, if the adjacent or the next tooth or the successive tooth is trying to come and there is a canal or a pathway for the tooth to come out, then you don't need a space maintainer because this itself will maintain by itself. However, if you don't have the permanent tooth in proper alignment to this succession, then you will have to give a space maintainer, because that will help you retain the space. If you lose the space, the mouth will look like a collapsed mouth. So that's why we call the collapsed dentition, right? Next is, as I told you, not every tooth needs a space maintainer, and not that every child or every tooth in the oral cavity of that child would need. Maybe some might not need at all. So let us look at a lot of options where you will see. Now in this case, you can see this picture where one tooth is erupted, the other tooth is just erupting. So we can actually do a procedure called operculectomy. Operculum is the tissue over the tooth. So we remove that tissue. It's called operculectomy. So you can remove that, and that itself will help the other permanent tooth to come in place. So how do I know when I should take assistance from my dentist to take my child to the doctor? You should understand that all of us, you, me, everybody, we all need to visit the dentist once in 6 months. So if we are regular, or when we are regular to the dental office, then the doctor would tell us if we need these space maintainers. So as I told you earlier, the primary teeth serve as the best space maintainers for permanent dentition. So as much as possible, let us hold on to the primary teeth. However, if there is a premature loss or extraction of the primary teeth, like you see in this picture, the permanent teeth might get submerged or they might get impacted within the bone, not having space for it to come out, and thereby, see, if it is a favorable one, then it might come out in any other direction. But if it is not favorable, it will actually stay inside the bone and cause further problems later in the patient's life. So it's very important for us to take some x-rays, and thereby we'll be able to guide and help people to understand how this entire process can go. So this is just a kind of a diagram to help us understand what all are the main teeth which go missing or which gets impacted, and what is it or how is it that the doctor will help us. So when you look at the suction tooth, one is the primary molar, the secondary molar, or the second primary molar, and the primary cuspid. So I told you there'll be 5 teeth in one side, right? So the teeth number 3, 4, and 5 is what we're talking about. When I say 3, I mean from the midline, from the center of the teeth, of the mouth, you have to count 1, 2, and 3. And similarly, the tooth behind and the tooth next to it. So whenever there is a primary tooth, molar or the first molar removed, this successor tooth will come only at the age of say 12 or 30. That successor tooth is going to be the premolar, the second premolar, right, in the permanent dentition. But however, you will have the 6-year molar erupting at the back. So that force of that molar, 6-year molar, is supposed to be very strong tooth. So that will push the other teeth closely, and that will move towards the center, thereby not giving space for any other teeth. So in such cases, we give a band and a loop kind of a retainer, and I will show you all these pictures. Now, if the secondary molar or the second primary molar is missing and the first molar is already started to erupt, then it's better to hold on to the arch with a lingual appliance called the lingual holding arch, and I'll be showing the picture in the consecutive slides. However, if the cuspid or the canine is actually gone, the canine is actually a cornerstone of the oral cavity. When you smile, you see the canine in place. However, if due to caries or trauma, this tooth is missing, then it is better to take again a lingual arch appliance and then give the, the space for the canine, because we need the permanent canines to come. And in such cases that we are not able to manage all the teeth, then we do a procedure called serial extraction, which means we give way for the permanent teeth to come in a consecutive sequential manner. So there are 4 types of these kind of space maintainers. The first is the crown and the loop kind. So here you can see there is a cap, there is a missing tooth. So we don't want the crown tooth also to move forward. We don't want that natural tooth to move backward. So we give a space, and this, if you can see the design, it will allow the teeth to come in between. And as the tooth erupts, then you can remove off this crown and loop. Second is a distal shoe kind of an appliance. Now, when I say distal shoe, you can see here in this X-ray, the permanent first molar, that is a 6-year-old molar, has come. The 2 premolars are inside. The canine is also inside. And the first primary molar alone is there. They have removed the second primary molar. Now, in this case, we give a guidance for the premolar to come out. And that is why you have the distal shoe. So you can see a projection into the bone. That projection will actually act as a guide for the premolar to come into position. The next is the lingual space maintainer. Lingual means towards the tongue. So towards the tongue, if you look at this picture, you will see there is an arch there, a kind of a U appliance. Now that is cemented or bonded, or you can even weld it or solder it to that crown or a band which is placed. And this will have a kind of a extra support, or give an extra support so that we don't lose the arch space. So this is very important. Next is unilateral or bilateral. Unilateral means only one side it is given. Bilateral means both the sides it is given. So as I told you earlier, the primary loss of the primary teeth or the premature loss of these teeth is the most common cause of malocclusion, and space maintainers basically help us prevent this malocclusion or complication. Now, what happens if I don't do anything, right? That would be the first question. If I don't do anything, the teeth will come haywire, and then the child would need to go in for an orthodontic treatment, which means they'll have to put clips, right? Now, space maintainer will help us actually prevent that procedure. We all know prevention is better than cure, but sometimes we don't take a proactive, thought towards that. That is the most important thing. Next is the dental space maintainers. Now, the dental space maintainers, if you look at this picture, you can see the premolar is actually directionally, it is moving one side. But now with the space maintainer, it is having space for it to come. It is trying to move itself. And as it moves itself, it is coming into its original position. So this is very important. We need to allow the tooth to grow. It will hardly move around 1 millimeter per month. But nevertheless, as the tooth is growing, if we are giving it a space, then it will try to make it into its original position. And initially, if you look at the diagram, you will see that the root formation is not complete. But towards the end of the X-ray, you can see that the root formation is complete, which means it has taken at least 2 years for the tooth to actually turn and come in position. So we need to have a lot of patience, and it's not very painful for the child also, but we need to pre-educate both the parents and the child so that they are, in synchronized thought process with the dentist. Now, space maintainers, as I told you, they are used to preserve and maintain the space. And this happens when any kind of trauma can happen on the child. So you can see here various kinds of trauma. I'm not going to talk about the trauma part of it today. I will have a separate session for that because this itself will be a huge topic. Nevertheless, any injury on that area of the oral cavity, you can understand that that child might need a space maintainer. And what does this do? It actually allows the permanent teeth to erupt or grow, and it also allows the tooth to come into correct alignment. And this is very important. And as it grows, it should also have a proper contact with the adjacent teeth. Contact with the adjacent teeth will prevent the unnecessary movement of the tooth. So here you will see that multiple teeth are missing. We are giving an acrylic base, and along with the acrylic base, we have also given temporary teeth. So these are just to give you a basic idea that how we can help restore a function for these kind of patients. Most of the times as the child grows, it might become very difficult for the child to eat if they don't have teeth, proper teeth, right? Even speech can get disturbed. And today, most of the families have only 1 or 2 children. So it is very important that we keep up the self-esteem or self-confidence of each of these children so that they feel very confident about themselves. Now, space maintainers are kept until the permanent teeth is ready to come into place, and it could vary from few months to few years. I told you in some cases it can go even more than 2.5 years, and regular follow-up. So at least once in 2 months, it's better to come and meet the doctor, and a doctor would say probably an X-ray, say once in 6 months or once in 8 months. So this will help the tooth, get a guidance of how much the tooth has moved in this time. And it is also very important for us to understand that in such cases, we need to have a lot of proactiveness from the tooth also for it to come out. So every time we work on these kind of patients, we prefer the age groups of say maybe 9 to around 13 years. If it is more than 13 years, it may be, we might have to extract it also. So many parents generally worry whenever we say, oh, we are going to give an appliance, they worry whether this appliance will cause pain or it will be pokey in nature, and will the child know how to brush his teeth? Will it be playful that it will come out, and when the child sleeps, will it fall back? So these are the general questions. It's actually nothing to worry. You can, use this space maintainers, and these are very painless procedures, and even the patients are very comfortable wearing such appliances. Now, once we place this appliance and imagine that the tooth has already come to place, what we do is we remove these appliances, and it takes us only around 5 to 10 minutes to remove, clean the other teeth and debride them, and the tooth is ready for management by the patient themselves. So we use certain specific, pliers, as we call it. We use it to remove the band or the crown and bridge, and thereby we are also able to remove that space maintainer which was holding on to that tooth. So with that, I come to the end of today's presentation. Any questions? I'll be very happy to answer.
Doctor,
yes,
good evening.
Sir. Good evening, sir.
Actually, you are able to get a good, very good information about space maintainers. But incidentally, it is happening only in the children, or grown-ups also have that kind of, what do you call it, this disturbance of the teeth?
Generally, this happens when the child is going through this phase where the primary teeth are shedding and the permanent teeth are yet to come. So that is why space maintainers, if you ask in particular, it is only for children. However, if you look at any extraction of the teeth in adult, maybe say from the age of say 13 onwards, where they were a teenager, they've removed the tooth either due to maybe, if I can say, they have removed because of caries, or they also had a root canal or something like that, and that is how they have removed the tooth. In those cases, we have to, look at the appliances, or we call it either the bridges or the implants. So we have already done a session on crown and bridges. So that session will help us understand. For adults, if they have lost tooth, how do you work out on that? And I will be taking a session on implants separately to help you understand in case of a missing tooth in a adult. Now, when I say adult, I'm talking anyone above the age of 18 years of age. So anybody above 18 years of age, we will be giving this kind of implant. And that is what we do for the adult. For children, it is whatever the space maintainer, we are talking from the age of 9 to the age of, say, 12 or 13.
Okay. Because I also invariably see children having that kind of thing, space.
True, sir.
Yes.
True. But it is very important, and it is that, if we don't do that, as I told you, the teeth will move front and back, and because of that, the malocclusion will set in. That means the child will not have a proper alignment of the teeth. So in case that happens and the child comes along with the parents at the age of 12 or 13, or say anywhere by 16, this crisscross arrangement of the teeth might cause a kind of a lower self-esteem or lower self-confidence in today's children. Because see, this is a selfie world. Everybody, is taking selfie and they want to look good in the selfie. So that is the reason. Yeah. So that is the reason today the alignment of the teeth is very important. So what I have shown here as a space maintainer is a prevention is better than cure. So in that sense, we have shown this.
But another question is, another pertinent question to that is it a permanent feature, or after some years they can remove it, just like
as I showed it in the picture, we place it and it is a fixed appliance, so which means the child can't remove it, only the doctor will be able to remove it. That is one. Second is, it will last maybe up till 2 to 2.5 years, and then we will remove it. Once the tooth comes in position, we'll remove it. So I can't tell it is a permanent one. We remove it as the tooth comes out. However, when I think about a bridge in terms of an adult or an implant in terms of an adult, I don't remove it. It is permanent.
Oh. Then what about the clips? Some people, even adults, I am seeing them wearing for so many years.
So when we say clips, that is a general word. We say orthodontic brackets or braces. Any of these words we use. So what it is when the child comes to us after the age of 16 or 17. Now, by the age of, say, 18, all the permanent teeth will come into place. I said 32 teeth, right? So when I say 32, out of that, 28 teeth will erupt by the age of 12 or 13. So after that, once this has already happened and the teeth are not in alignment, then we need to take two types of x-rays. One x-ray is an OPG, which gives us a complete direction of the teeth. One is lateral ceph, which we take an x-ray on the side of the mouth. And then we go ahead with some casts. We take some impressions of the patient's mouth, and then we put the clips. So that is the orthodontic clip I'm talking about, or braces as what you asked. And that might take around 1 to 1.5 years for the treatment. And in certain cases, it might even take 3 or 4 years. Now, what decides this 1.5 years or 2 years or 3 years? The severity or the complexity of the tooth alignment. So if it's a very simple case, we can finish even within 8 months to 1 year. If it is a medium case, we do say 1.5 years to 2 years, maximum 2 years. But if it's a very complex case, sometimes even needing surgeries, it might go even up till 3 years. So why do we take this time? It is because we allow the bone also to grow along with the change of the tooth. If we give very high pressure, the teeth will move fast, but the surrounding bone will not move. So the foundation will become weak. And because of that, if you look at it, sometimes after we remove the braces, the teeth will become loose. So we don't want that. So we do a very gradual movement of the teeth.
Because my sister-in-law's daughter was using that brackets, what are the technical names you use?
Yeah.
But after some years, she removed it. It was removed.
Correct.
That's why I asked. Okay.
Correct. What you said is absolutely right, sir. You wear it for 1 or 2 years, and generally after 2 to 3 years, they remove it. Initial phase, they will wear something called the fixed brackets, and the second phase, that is after the treatment is done, they wear a removable appliance or a retainer, as we call it, and sometimes it goes to the third phase where they wear a permanent lingual retainer inside the oral cavity, inside. When you see, it will be inside, both on the top and on the bottom.
Okay, thank you very much for the sharing of that information.
Thank you so much, Ravi sir, for that wonderful interaction. I think, it is so nice that you sit and ask questions.
It has all come from you. No, that is what we are observing. You have been interacting with us. So you are giving so much information. So it is naturally for us to pose some questions to you so that we will be enlightened with new information, which we were not aware.
Thank you, sir. I think that is the entire essence of crossing boundaries. We are crossing boundaries and getting out of our comfort zone just to reach out to all, our patrons in their own houses, to help them understand dentistry better so that, we can serve them better. In fact, and we are uploading it in our YouTube channel also, so that in case you missed this session or any other sessions you have missed, you can always, go back and look into it and like, share, comment, and, share it with friends who might need this particular topic of discussion.
You are doing a great service, because everybody will not be so much interested to know, to let the patients or for information's sake. Nobody will do that. And you are doing a great service to the
Thank you so much, sir. Thank you so much. Any other questions?
Okay, carry on. Yeah.
Thank you so much. Kripa Shankar sir, you wanted the YouTube link. The YouTube link is called Team Red Rockstars, Dr. Vidyaa Smile Dental Clinic. You can also take down my number. My number is 98401 76088. I will, once you ping me on WhatsApp, I will also share you the link also. You can subscribe to the channel. We have a lot of series, what we keep sharing. You have an access to all of them. You can view everything to help you understand the different aspects of dentistry also. It is very useful.
Sure. Thank you, Doctor.
Thank you so much, sir. Thank you so much.
Bye-bye. Have a good day.
Thank you. Thank you so much. Any more questions? Okay. So thank you so much, patrons, for joining in today. As always, it's been a great evening sharing this simple topic with all of you, and hope to see you soon next month, as always, with a separate topic, so that you can learn a little more about dentistry. And if you have any such questions which you think that we need to address and answer, please let us know. You can ping me and I will make a session especially with your questions, like I did for today's session, and it will help a lot more people understand and get our services done. We have currently shifted our practice to Westmamblam. So for address and location, please get in touch with me. I will be able to help you, and do visit us. It will be great to serve you much better. So thank you. Good evening and take care.
Yeah, Doctor.
Thank you, sir.
One small doubt, Doctor. We can use this mouthwash every day?
You can use a mouthwash every day, definitely.
That will damage any enamel?
No.
Whether it will damage gums or enamel, the Listerine?
Yeah, so generally certain mouthwashes will cause discoloration of the teeth. I'm not naming certain companies, but generally when I say mouthwash, you can just take warm water, put a little bit of salt and gargle. That should be enough. Until and unless you have any inbuilt problem which the doctor has told you to use certain other mouthwashes which you have to buy from the market and use, those when used over a longer period of time can stain your teeth. So that is why if you're using such mouthwashes, then as you said, you might have a yellowish brown or even a black color to your teeth. Some bacteria, which is called chromogenic bacteria, those are, chroma means color giving.
Color
bacteria in the oral cavity will give color. So along with this mouthwash, you might even have colors like gray, brown, black on your teeth also. So those will be in terms of chromogenic bacteria, which is present in the oral cavity. So generally, if you ask me, can I use mouthwash? I will say yes. And you can
that
use
means
salt
only
water.
salt water.
The salt water is enough. Yeah.
Right. And another thing, for the dietitian for weight control, they are asking to drink apple cider vinegar. So whether that will damage enamel something?
Very good question. Apple cider vinegar, the problem with it is it has a lot of acidic nature in it.
Yeah.
So when you take it, like if you're just taking it down
we
your
dilute
throat,
with warm water. Yeah.
Yeah.
We dilute with warm water.
Correct. When you just take it down your throat, nothing will happen to your teeth. So if you're going to drink it above, then no problem. But if you're going to put it in your oral cavity, swish, swash, and then take it inside, there will be a damage on your teeth. So when you're taking this apple cider with warm water, you can just drink it, gulp it down your throat. So that then it will not be a problem.
Okay. 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 Thank you very much.
Thank you so much, Kripakar sir. Shankar sir. Thank you so much.
Thank you.
So keep coming. We will be sharing our link and we will have another session next month on the same Crossing Boundaries platform. Till then, take care of yourself. Please get vaccinated, stay safe, and waiting to see you and serve you better. Thank you.
Sure. Meet you soon. Thank you.
Thank you, sir.
Thank you.
Thank you.